So I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. I want to welcome you to our Advocacy and Public Policy webinar today, Navigating Your Care and Treatment, a Medicare Example.
Every year you have the opportunity to enroll and re-enroll and can plan your, pick your plans and cover your options, right? Medicare enrollment, initial enrollment, special enrollment, and open enrollment are all distinctly different. And it's kind of confusing, and I didn't want to put that slide up. What I wanted to say is this is your time. You have 7 weeks in which you can either switch to an Advantage plan, switch to traditional Medicare with a Medicare plan, right? And you could do this every year, okay? With the caveat that you may not be, if you leave a Medicare Advantage plan, you may not, in fact, be able in your state to get a Medigap plan, okay? This gives you a full 7 weeks before you can receive, have your cards in hand for January 1 coverage. These are just some questions that you should consider when you're reviewing your plan, like what are some of the things that you want to worry about, right? And just when you should reevaluate your options. Next, please. Okay, this is important. So coordination of benefits. Medicare is weird in that they have very long and detailed protocols and laws in order to coordinate benefits. It is super important that you tell everybody, right? Whether it's your providers, whether it's your insurers, if your employer, right? Just as Randy mentioned, if you have employer-sponsored health insurance, tell your employer or the benefits administrator, because if you have concerns whether or not your coverage would count as supplemental, ask your employer or ask your benefits administrator, right? And quite often, if you have very strong union-based coverage, it will in fact act as a perfect supplemental plan in that you can enroll, in that you can maintain that coverage and enroll in Medicare. But what is super important is that if you have any changes or other insurance, you have to let Medicare know. Medicare is not magically going to say, oh, Lynn, I see that you've changed your job and your coverage, right? You have to let them know. And you'll have to let all the providers and insurers and so forth know that in fact you have multiple forms of coverage, right? And don't worry about who pays first. Trust me, Medicare will tell you when they know. Okay, and quite often it's Medicare determines who pays first. The coordination of benefits, if you just go to medicare.gov and search coordination of benefits, there are multiple manuals about exactly how, in fact, they do coordinate benefits. Next slide, please. Okay, and this is just a standard, okay? Don't decline Part D, please. Just because you are not on any medications now, as I made the pitch earlier, if you are on pain meds or any other meds, heart, cholesterol, or will be on those meds, you will need to have Part D. Moreover, you'll be penalized for each month you decline Part D or Part B for the rest of your life. Okay, so if you're sitting there going, I don't need it, right? Well, and then it turns out you do, right? You have to sort of pay if you don't have other creditable coverage. And you can order to find out whether or not you have creditable coverage, right? You can ask your employer and whatever. This is all about finding this balance between affordability and access, right? Medigap plans or supplemental plans have higher premiums than Advantage plans, and more expensive ones offer greater out-of-pocket protection costs, coverage. That is important to some people, and it's just a matter of deciding if that is important to you. Do you want to have higher premiums and more coverage, or what do you want more programs in Advantage? Next slide, please. Okay, this is pretty self-explanatory. There are limited financial assistance options, okay? These limited financial assistance options, we'll go through on the next slide real quick, and are based, next slide, are based largely on income and resources. Here, Medicare knows people are on a fixed income, okay? Medicare does appreciate that. Okay, there are a number of different ways that you can qualify and what you can qualify for based on these series of federal programs. There are federally funded programs that can pay part or all of your premiums and or deductibles based on what your income is, your assets are. And if you qualify for any of these, the Quimby, the Slimby, or whatever, right, that you have to remember that these will also likely qualify for you for the Part D extra help coverage, okay? Some other forms of assistance are, okay, Medi-Cal, right? Medi-Cal is your state Medicaid program. There's also state pharmacy assistance plans, and 21 states currently have assistance plans. There are PACE programs, or all-inclusive cares for the elderly, which basically bundle Medicare, Medicaid, or dual eligibles. Next slide, please. Changes happen. We know this, okay? Plans can change, as can their costs and coverage options. Some plans may choose to leave Medicare entirely, okay? But plans are required by law to mail or provide electronically an annual notice of change, which explains these changes and the departure from last year's coverage and the explanation of coverage, right? Why is the coverage changing, and how can you go about figuring that out? And review the plan before open enrollment, as always, right? Because you want to know, they'll often publish the options. They're never like, oh, you need to enroll by midnight tonight, right? They're going to give you a window. In Medicare's case, it's 7 weeks. So review during that time and make a wise decision. Next slide, please. Ask for help. These are, help resources. Next slide. Okay, and then there's Lynn has Lynn can send you a PDF of all the slides, which has a number of resources, right? There are non-biased sources non-biased people who are resources, and they know a lot about Medicare. They may not know a lot about hemophilia, but they sure do know a lot about Medicare. They have access to forms and templates that we can't possibly know. So if you went in there explaining that, factor is covered, or any sort of bleeding disorder treatment is covered under Part B, they can fill in the rest. So don't discount the SHIP state health insurance assistance program people, which are your local health people, when you're shopping for plans. Next slide, please. And SNFs implementation law. I just shout out to SNFs. SNFs are currently covered. Medicare covers SNFs under, we were able to pass the law. So if you or any of your loved ones, and I'm sad that Randy left because his idea for nursing homes in California is kind of gone. They are, we'll figure out a way, because the SNFs are learning about us, we're learning about them, and it's there's a lot of education to be had. So if you need assistance, please reach out to us and just me, and we'll figure it out, okay? And I think that's it. And now I can answer questions, and I talk super fast, I'm sorry.
Marla, thank you so much. This was super informative and helpful. I want to also thank Oh, go ahead.
Sorry, before you thank this, so you'll send out the open enrollment in California 2022 fact sheet, as well as the slide deck, correct?
Correct.
Because there's a lot of really great, it has a link to the handbook, it has all these important dates and deadlines and when things start. It gives you a lot of specifics to California about the Medicare Savings Program and the number of plans offered in your state and what percentage, blah, blah, blah. So
yeah, we'll send that out to everyone who registers.